So composite bonding has probably been around since, for the last 30 or 40 years. What has changed in recent times is the quality of the material that we use to put on the teeth. Essentially, composite bonding is where you put a white filling material over the front teeth, usually to change the shape and quite often to change the color of the teeth. What has changed in more recent times is that the material now is every bit as cosmetic as it used to be, but it's stronger, it's more durable, it needs less polishability, and it just looks much more like a natural tooth. In the past, the composite bonding, the composite veneers that we would have done would have pitted and roughened and picked up stain a lot more quickly than they do today. And I suppose it is a super treatment insofar as it's relatively reasonably priced, and it's also very versatile, and a lot of patients decide to go for the treatment for that reason. So with composite bonding, it's possible to use it in all sorts of situations. Probably one of the most obvious is where you have a gap between teeth, between a diastema between your front teeth. It also is very useful if your teeth aren't the shape that you want them to be. Maybe they're too rounded and you would like them to be more rectangular. And also more and more to change the color of the teeth. As the materials, as I say, the technology being used in them is unbelievable. It is, and they're able to produce them in much lighter shades, bleaching shades, and as I say, they're incredibly durable. Really used mainly in today's world for your anterior teeth, to change the smile to something that you want that's better than what you have. It's also used in posterior teeth. Composite is used in posterior teeth, but we wouldn't recognize that as composite bonding. Composite bonding or composite veneers are generally used on your anterior teeth. So with composite bonding, we probably, in most cases, do a little bit of roughening of the surface of the teeth in order to improve the attachment of the material. We etch the teeth and we bond the teeth, which really means that we put a very flowable material over the teeth that produces tags into the enamel of the tooth. And then on top of that, we put our composite material in the shade and shape that we want the tooth to look. And obviously what we do is we build up the teeth one by one to the shape and the color that the patient has requested. So composite bonding can last for years and years. It's obviously dependent on how the patient looks after it. If they drink a lot of acidic drinks, it will obviously dissolve away. It's not as strong as the enamel of your teeth, so it will wear away and it will pit if the patient doesn't look after it appropriately. Also looking after the gum health to make sure that that we don't get damage at the gum margin through decay. So a lot of it is dependent on how the patient looks after it. But in a normal patient who cares about their teeth, I would probably say that it can last 8, 10, lots of years. What I would suggest is from time to time that they're going to have to come back. I describe it like a wooden floor that you, from time to time, you'll want to sand and polish it. You'll want to sort of bring it back a bit and then polish it up to renew the look and to refresh the look. Very, very, very little, if anything. Occasionally, you might need to sort of remove enamel between the teeth to create a better contact, a better angle between the teeth. And I suppose you could say that it might be a little bit uncomfortable when you do that. But if your gums are healthy, that probably won't be the case. And apart from that, yes, it's done without a local anesthetic, and I would suggest that it is relatively unpainful or relatively not painful.